10 Early Signs of Prostate Problems. Welcome back. So far, we've covered the first 3 warning signs that many men mistake for normal aging. But the next 3 symptoms are often more noticeable, and in some cases, they may suggest that your bladder or prostate needs medical attention. Let's continue. Have you ever finished urinating only to feel like there's still urine left inside your bladder? A few minutes later, you're back in the bathroom again. This feeling of incomplete bladder emptying is one of the most common symptoms of an enlarged prostate. As the prostate grows, it can partially block the flow of urine. This makes it difficult for the bladder to empty completely. Over time, the bladder has to work harder every single day. Imagine carrying a heavy backpack everywhere you go. Eventually, your muscles become tired. The same thing can happen to your bladder. When urine remains inside the bladder, it may also increase the risk of urinary tract infections or bladder stones in some people. If you constantly feel like your bladder never fully empties, don't ignore it. It's a symptom worth discussing with your healthcare provider. Urgent need to urinate. Have you ever suddenly felt an overwhelming urge to urinate, so strong that you immediately start looking for the nearest restroom? Sometimes it happens while driving, sometimes during a meeting, or even while shopping. That sudden feeling can be stressful and embarrassing. Many men with prostate enlargement experience urinary urgency because the bladder becomes more sensitive. Even when it contains only a small amount of urine, it may send powerful signals to the brain saying, "Go now." Some men even worry about leaking urine if they don't reach a bathroom quickly enough. While occasional urgency can happen for different reasons, frequent episodes should never be ignored. The sooner the cause is identified, the sooner it can often be managed. Pain or burning during urination. Now let's talk about a symptom that many men find alarming: pain or a burning sensation while urinating. This isn't something you should simply wait out. Although burning during urination is often caused by a urinary tract infection, it can also occur alongside prostate inflammation, known as prostatitis. Some men describe it as a sharp sting. Others say it feels like intense burning every time they urinate. You may also notice discomfort in the lower abdomen, pelvis, or the area between the scrotum and the anus. These symptoms deserve prompt medical attention because they can have several possible causes, and treatment depends on identifying the right one. Trying to ignore the pain or hoping it disappears on its own is rarely the best approach. If you develop burning, pain, fever, chills, or difficulty urinating, contact your doctor as soon as possible. Why men ignore these signs? Here's the problem. Many men avoid talking about urinary symptoms because they feel embarrassed. Others convince themselves it's just old age. But growing older doesn't mean you should accept symptoms that interfere with your daily life. Many prostate conditions, including benign prostate enlargement, BPH, prostatitis, and in some cases prostate cancer, can cause similar urinary symptoms. Only a healthcare professional can determine the cause through the right evaluation and testing. Early assessment often leads to more treatment options and can help prevent complications. So far, we've covered 6 important warning signs. Frequent urination at night, weak urine stream, difficulty starting urination, feeling that the bladder never empties completely, sudden urgency to urinate, pain or burning during urination. But we're not finished yet. If you've watched this far, you're already learning symptoms that many men overlook for months or even years. The next three warning signs are especially important because they may indicate that your prostate or urinary system needs prompt medical attention. Let's continue. Blood in the urine or semen. Imagine looking into the toilet and noticing something unusual. Your urine has a pink, red, or brown color. Or perhaps you notice blood in your semen. Even if it happens only once, never ignore it. Blood in the urine or semen is not a normal part of aging. There are many possible causes. It may be related to an infection, inflammation, enlarged blood vessels, kidney stones, or a prostate condition. In some cases, it may also be a sign of a more serious medical problem that needs prompt evaluation. The important thing to remember is this: you should never try to diagnose the cause yourself. Many men delay seeing a doctor because the bleeding stops after a day or two. Unfortunately, the disappearance of blood doesn't always mean the underlying problem has gone away. That's why doctors recommend getting checked whenever you notice blood in your urine or semen. Early evaluation can make a significant difference. Leaking urine or losing control of your bladder. Have you ever noticed small drops of urine leaking after you've already finished? Or maybe you suddenly feel such a strong urge to urinate that you can't hold it long enough to reach the bathroom. Many men find this embarrassing. Some even avoid traveling, long meetings, or social events because they're worried about accidents. But here's something important. Urinary leakage isn't always just a normal part of getting older. As prostate problems progress, the bladder muscles can become irritated or overworked. Over time, this may affect how well the bladder stores and releases urine. Some men notice only a few drops after urinating. Others experience sudden leakage without much warning. Although bladder leakage can have many different causes, it's a symptom that deserves medical attention, especially if it's new, becoming more frequent, or affecting your quality of life. Remember, you don't have to simply live with it. There are often treatments that may help, depending on the cause. Pain during or after ejaculation. Now let's discuss a symptom that many men feel too embarrassed to mention, even to their doctor. Pain during or after ejaculation. This may feel like discomfort, pressure, burning, or aching in the pelvis, lower abdomen, or between the scrotum and the anus. Some men notice the pain only occasionally. Others experience it almost every time. Painful ejaculation can occur for several reasons, including inflammation of the prostate, certain infections, or other conditions affecting the reproductive or urinary system. Because there are many possible causes, it's important not to assume the reason without a medical evaluation. Ignoring this symptom may delay diagnosis and treatment. If you experience persistent pain during or after ejaculation, make an appointment with your healthcare provider. The sooner the cause is identified, the sooner appropriate treatment can begin. Who is most at risk? You might be wondering. Who is more likely to develop prostate problems? While any man can experience prostate issues, the risk generally increases with age. You may have a higher chance if you're over the age of 50. Your father or brother has had prostate disease. You have obesity or a sedentary lifestyle. You don't exercise regularly. You smoke or consume excessive alcohol. You have diabetes or certain metabolic conditions. Having one or more of these risk factors doesn't mean you'll definitely develop prostate problems. It simply means regular medical checkups become even more important. We've now covered 9 important warning signs that every man should know. Frequent urination, weak urine stream, difficulty starting urination, feeling the bladder doesn't empty completely, sudden urgency to urinate, burning or pain during urination. blood in urine or semen, loss of bladder control, pain during ejaculation. But we're saving one of the most overlooked warning signs for last. Finish with a powerful conclusion and call to action that leaves viewers with clear next steps. Conclusion. We've already discussed 9 warning signs that every man should know. Now it's time for the final warning sign, one that thousands of men ignore because it develops slowly over time. Unfortunately, waiting too long can sometimes make treatment more difficult. Let's look at the final sign. Warning sign number 10. Difficulty completely emptying the bladder or inability to urinate. 2150, 2400. Imagine feeling an intense urge to urinate. Your bladder feels completely full, but only a few drops come out. Or even worse, nothing comes out at all. This is not normal. In some cases, a severely enlarged prostate can block the flow of urine almost completely. This condition is called acute urinary retention, and it requires immediate medical attention. Some men try to wait a few hours, hoping the problem will go away. But delaying treatment can increase the risk of bladder damage or kidney complications. If you suddenly cannot urinate, or you have severe lower abdominal pain along with a full bladder, seek emergency medical care immediately. Even if your symptoms are not severe, needing to strain constantly or feeling unable to empty your bladder completely should always be discussed with your doctor. What causes prostate problems? 24 minutes, 26 minutes. Many people believe that prostate problems only happen because of old age. The truth is, age is only one factor. Several conditions can affect the prostate. The most common is benign prostatic hyperplasia, or BPH, which means the prostate has become enlarged, but is not cancer. Another condition is prostatitis, which is inflammation of the prostate. It may be caused by infection or other factors, and often leads to pain and urinary symptoms. There is also prostate cancer. In its early stages, prostate cancer may not cause any symptoms at all. That's why regular checkups are so important, especially for men over the age of 50 or those with a family history of prostate cancer. Remember, urinary symptoms alone do not automatically mean cancer. Many non-cancerous conditions can cause similar symptoms. Only a doctor can determine the exact cause through an appropriate evaluation. Who is at higher risk? You may have a higher chance of developing prostate problems if you're over 50 years old, your father or brother has had prostate disease, you are overweight or obese, you have diabetes, you smoke, you exercise very little, your diet is high in processed foods and low in fruits and vegetables. Having these risk factors doesn't mean you will definitely develop prostate disease, but it does mean paying closer attention to your health is a wise decision. How to support prostate health? The good news is that healthy lifestyle habits can support your overall prostate and urinary health. Here are a few simple steps. Eat more vegetables, fruits, whole grains, and healthy fats. Include foods such as tomatoes, broccoli, berries, nuts, and fish as part of a balanced diet. Stay physically active. Even a daily walk can support your overall health. Check. Drink enough water throughout the day, but if frequent nighttime urination is a problem, talk with your doctor about the best timing for fluids. Maintain a healthy weight. Avoid smoking. Limit excessive alcohol intake. Schedule regular health checkups, especially after age 50. These habits cannot guarantee prevention, but they contribute to better overall health and may reduce the risk of certain conditions. When should you see a doctor? You should make an appointment with your doctor if you experience frequent urination that interferes with daily life, difficulty starting urination, a weak urine stream, blood in your urine or semen, pain while urinating, pain during ejaculation, repeated urinary tract infections, sudden inability to urinate. Early evaluation often leads to earlier treatment and can help prevent complications. Never ignore symptoms simply because you think they're just part of getting older. Powerful conclusion. Our body is incredibly intelligent. Long before many health conditions become serious, it often sends warning signs. The question is, will you recognize them? Millions of men spend months or even years ignoring symptoms because they're embarrassed or believe they're simply getting older. But paying attention to your body and seeking medical advice early can make a meaningful difference. Remember the 10 warning signs we discussed today. Frequent urination, waking up several times at night, weak urine stream, difficulty starting urination, feeling your bladder isn't empty, sudden urgency to urinate, burning or pain during urination, blood in urine or semen, pain during ejaculation, difficulty urinating or sudden inability to urinate. If you notice one or more of these symptoms, don't panic, but don't ignore them either. A simple medical evaluation can provide answers and help determine the best next steps. Your health is worth protecting. If you found today's video helpful, please like, subscribe, and turn on the notification bell so you never miss our latest health videos. Share this video with your father, your brother, your husband, or a friend. It might encourage someone to recognize an important warning sign and seek medical care earlier. Now we'd like to hear from you. Have you or someone you know experienced any of these prostate warning signs? Leave your thoughts or questions in the comments below. Thank you for watching Health First Priority. Stay informed, stay healthy, and we'll see you in the next video.